Assalamu alaikum. Your Excellencies, esteemed guests, guest of honors, pretty girls, I mean ladies and gentlemen, good evening. First of all, I actually gather all of you here for one reason. All these medical experts, all these doctors, all these people who hold PhD, to ask you one question. And this is related to my health, actually, and that's why I brought you here. It's not about Arab Business Club event. The question is, since I'm a teenager, until now, I have the same problem. When I see a pretty girl, my heart beats very fast. So I hope someone of you doctors will help me with this. I'm very pleased to welcome you to the first annual Arab Business Club healthcare event. This event, inshallah, will hold it every year in different Arab countries to help our friends from the advanced countries and the Arabs to work together, and also Arabs with talents to show to the world that we are actually having experts on the medical field. It is my honor to thank our guest of honors for coming here, Engineer Subhi Paterji, and Dr. Shamshir, VP. There's two doctors who couldn't make it today. One of them, he was supposed to be a speaker, and they did a remarkable business here. One of them, Dr. P.R. Shetty, and the other one, Dr. Thombi Mohiddin. So they send you their sincere apology for not coming. One of them, he's not feeling well, and the other one got delayed in Abu Dhabi. We organized this event, the first annual healthcare event, so that our member can share ideas, trends, strategies on how to benefit from more of the healthcare growth on this important sector, and especially on the Arab world. On GCC healthcare market, it's projected to grow at an annual rate of 11% to $43.9 billion, $25.6 billion in 2010, with Saudi and UAE the fastest growing markets. Outpatients and inpatient market are expected to account for 82% and 18% respectively of the all over market size. Hence, we aim at this event, we will mark as a big contribution on the healthcare sector for source as the key to open for new agreements and investments and opportunities. You will have here so many people coming from around the world to meet people who's based on this part of the world, and vice versa. So take this opportunity to actually meet them, take this opportunity to mingle with them. The first plan about seating, and this is what we do in every event, we actually sit each company members in different tables, so they actually can interact with new people and get to know new friends and make new agreements. I have witnessed the need for improvement for building new hospitals, supply of medical equipment, and even supply of staff, medical staff in countries that I visited during my last 3 months visits. And I think with your expertise, with your wealth and investments, and with your knowledge, you can actually reach and expand on these countries. We are looking forward to help you to meet the right partners, to meet the right investors, and to meet all the companies or government regulation in different countries that we are operating. Right now we are in 31 countries, and inshallah by next month we will be on Indonesia, so 32nd countries. You will see outside, as you noticed, there's many products for healthcare, but also there's many products that related to the human health, where I'm sure you will have the chance to talk to the company owners. I'm one of them, and the rest you will see them here. Last month, a few months ago, I visited Angola, South Tome, Poland, Hungary, Ukraine, Turkey, and Morocco. There's huge investment opportunities in healthcare sector and other sectors. My plan for the next month We are actually starting with Kazan. We are going to Kazan Summit in Russia in a few days. And we will continue to Asia. We have Asia opportunities. We are going to Indonesia. We are going to Malaysia, China, and Thailand. I invite all our members who's interested to actually benefit from these delegations to come with us. Lastly, since this is a health event and I'm not sure about how to advise you about health, I will leave this with the experts. I would like to welcome the speakers to come and give us the advices. And please don't forget my question about my problem. Thank you.
Thank you, Mr. Hamdan. I want to take this opportunity to thank Arabian Business Club for giving me this. And I'm the CEO of Saudi German Hospital, Dubai. I started this career since October 2012, so it's 1 year now. Our hospital considers is the last hospital now in SGH in Dubai. One of the services in our hospital, we can't, as I said, mention all the services because it will take a lot of your time. We are focusing on the very advanced radiology departments, gamma camera for nuclear medicine, cath lab. We are doing a lot of procedures of cath lab, and we have one of the advanced cath labs in the area. Our vision in our IT department is to build enabled hospital from vision to reality. Our vision is to have paperless hospital. And as I said, we achieved already 85%. It's not easy to achieve, especially in a hospital, especially when you have doctors who are not used or don't like to work with computers and IT system and resist all the time. But by patience, day by day, we are moving closer into achieving this vision.
Works in Europe does not really work on our populations. And there's a lot of research happening in that field, in particular in the Middle East as well, where we see over the last 2 years more clinical trials being developed, which wasn't really the case earlier. So it's no longer a market, but it's also a place where you can actually do research, and very interesting research looking at particular phenotypes and genetic disease areas. The healthcare sector, or the pharmaceutical sector, as you all know, is one of the highest regulated areas. Everything is regulated from registration, approval, to pricing, to the way you manage the clinical trials, and to the number of years it takes you to develop a product from its day one until it hits the market, and that's usually 15 years in between, with a cost that is estimated today at $900 million. So the product that you see on the shelf life of the pharmacy, there's a good chance that it took 15 years in development, and it cost the company that did the research somewhere between $700 to $900 million. And a lot of people actually ignore this, and that's why the pharmaceutical sector has taken a lot of hit over the last few years.
Good evening, ladies and gentlemen. It gives me a great pleasure being with you tonight. I'm working in the field of tourism industry, so I'm a little bit far from the medical treatment and medical equipment and this kind of business. I'm coming today just to offer you a new destination for your business. It's Ukraine. I'm offering different aspects of this kind of treatment. We are receiving clients from Europe, from the States, mainly for dental services. Dental services is highly expensive. We are supported, and our company are working with association with many clinics and hospitals, which is well known in Europe, and with many hotels specialized in spa treatment and wellness treatment. Let's say such as Rexus Precarpathis is a 5-star deluxe hotel, well occupied with a German equipment. A Swiss management of Chalet Graal 5-star deluxe hotel, as well occupied and managed by highly professional doctors and maid sisters, which are helping the clients after serious diagnostic with.
Ladies and gentlemen, good evening. I'm Markus Giebel, CEO of Eternity. Now, you will say, Marcus, how can a single presentation save my life? And the answer is actually quite easy. It was roughly speaking 1 month ago, we gave the same presentation to a similar group of people. And when we gave the presentation, after presentation, people came to us and said, Marcus, I would like to engage in your executive screening program. We said, you're very welcome, because that's what we do for a living, we screen people. Now, why is it so important for you? Now, first of all, it's important, of course, we safeguard our life, but the older we get, the more things are getting wrong. Think about driving a car. You drive a car for 10 years and you don't service it. Not good. I promise you this car will break down, and when it breaks down badly. Now, we are the same way with human beings. We run and run until we break down. We don't service ourselves, and I'll tell you a bit more about this later. Now, when you look at the life expectancy actually in 1930 was 59 years old. Now, when you look at the life expectancy in the year 2000, we talk about 77 years. And in 2050, if you get lucky, you may get even 100 years life expectancy out of you.
Very good evening, ladies and gentlemen. First of all, I actually would like to thank God for being here, because a health, you only have one. A health is something indeed like... So myself, I am indeed a patient who became a therapist since a number of years, who has a doctorate degree today, a PhD in health science and specialized in cellular therapy. Why I am here especially is basically because many people here also have, like Marcus Giebel said, genetic diseases. Now, as you can see, I'm not only here for kidney pot, I'm also here for other reasons. I'm a specialist in orthomolecular. I'm very much into cellular therapy, so I'm willing to open a clinic here. And as you can see, we are seeking partners for opening clinics for kidney pot, at least in one each emirate, to integrate a kidney pot actually with an analyze labo into one of the clinics, and that can be done in about a week time, 7 days it's done, because the training doesn't take that much and the software and everything is ready.
Mr. Kurt Middelburg.